Now we'll show the screen. And then move this so I can present. Okay. So welcome. Thank you for your patience as I got that set up. The active PT Women's Health or Pelvic Floor Therapy Department includes Heather and I. Heather Dunphy and I were both trained in a special kind of physical therapy that we've been trained to evaluate and treat the muscles of the pelvic floor, which are the muscles that are between your tailbone, sit bones, there's Heather and me. Between your tailbone, sit bones, and pubic bone is a hammock of muscles. So today I really want to help you understand the specialty of pelvic floor physical therapy, the conditions and symptoms, because you probably will be seeing some of those symptoms as you're training your clients. Many of these are common, but they're not normal. So if you have somebody that's leaking urine while they're exercising, that's not a normal thing. I'll give you some ideas for exercises that you can use and then how to know when to refer. So that's the basic reason I made the presentation. And if you have questions, again, make sure you interrupt me at any time. So we treat pelvic floor disorders in women, men. There is a pelvic floor therapy that does do children, but Heather and I do not. There are specialists that are trained in that. I think Mayo has one. So, but we help people with urinary incontinence, pelvic pain, tailbone pain, vaginal pain, and that sometimes comes with sexual pain, or even erectile dysfunction, pelvic organ prolapse, constipation, and then back, hip, or sacroiliac joint pain in the pelvis that's not improving with traditional therapy. So we get a lot of referrals from our colleagues that are kind of stuck. So these are images that show the female and male. The pelvic floor, if you can see my cursor, goes from the coccyx to the pubic bone, in between the two sit bones, and it helps us to coordinate bowel and bladder function as well as sexual appreciation for both men and women. And when there's a dysfunction, it can come from poor control, it can come from tightness or weakness, but then pain can also be an inhibitor or result in a lack of balance or control of those muscles. So common symptoms would be pain or fullness of pressure in the pelvic area. It can present as low back pain, kind of like period cramps, or pelvic pain, perineum pain. The perineum is that area that's just below the sit bones in between the legs. It can come with urinary leakage, frequent or urgent urination, constipation, pain or difficulty with urinating, and pain with sex. Like I said, it's common, but not normal. Up to 80% of athletes, though, female athletes especially, report incontinence, especially with high impact sports and then high training volume. I get a lot of people who lift weights that don't know how to control the intra-abdominal pressure that comes with a Valsalva. And then this, like my statistics show, it doesn't even, I mean, it doesn't always happen after babies. It can happen if you've never had children, never had sex. Female and college athletes also have these symptoms, and most people don't tell anybody about it. And some of my patients have come from the gyms that you're working with, and they just say, I'm sick of wearing a pad and hiding it. And so it's a barrier sometimes for people to exercise. So why does it happen? And like I said, it can be poor control, weakness, tightness. There's a condition called prolapse that can happen from too much bearing down with constipation or from having a baby. There can be kind of a lengthening or a stretching of the ligaments, and that gives support to the organs, and they can start to drop and descend onto the vaginal wall, or the uterus can even put pressure down into the vagina. So that's what prolapse is. And then it can actually be coordination with posture and running or gait. We make a lot of adjustments to people's exercise plans to help them to not leak when they exercise. So these are some ways that you can help. Understanding that the core is, I always think it's like a Quaker Oats canister. There's a top and a bottom as well as a surrounding canister. And the diaphragm is the top, pelvic floor is the bottom, transverse abdominis, your obliques, and front abs kind of, as well as your back abs and your back muscles, all come together and coordinate for core stability during posture and just helping us when we're exercising. Recognizing that breathing, coordination, and function is a really important part. And this picture on the side that shows the diaphragm, it's descending as it brings air into the lungs. At the same time, there is a kind of an outward movement of the abdomen area, and then a descent of the pelvic floor muscles. And this pump actually creates a way of releasing toxins from that area. So it's an important part of that, but as well as allowing a full range of motion of these pelvic floor muscles. So if the pelvic floor muscles are not getting relaxation, it would be as if you're trying to train a bicep and not getting through the full curl. You're just deciding to train it right here. And so we want to make sure we have that full range of motion that comes with a full diaphragmatic breath. So normally the core will activate prior to reaching for something, lifting something. It actually activates when you take a step. Right before the impact of your step, the pelvic floor will activate. And so in a normal environment, that will happen. In an environment that's dysfunctional, you'll get leaking, or you can get pain, or other of those problems that I was talking about. So training with breathing, I always recommend for people to exhale with the contraction or with the lift, or with, let's say you're doing a bridge exercise, you blow out as you did the push up. Or if you're going to stand up, that one's a difficult one because you have both eccentric and concentric, but I always exhale with the stand because that seems to be the more forceful. You're lifting against gravity. And then you'll inhale and relax pelvic floor, or you can inhale while you're holding pelvic floor, but on the eccentric. That's just usually a way to make sure people keep breathing. They don't get an increase in blood pressure. They don't get an increase in intra-abdominal pressure, which can push downward on the pelvic floor and contribute to that dysfunction. So I always ask people to avoid holding their breath unless they really need that Valsalva for the 300-pound lift if they're doing powerlifting. And then that's a completely different talk. So any questions so far? Hearing none. Okay. So relaxation is an important part. I think a lot of people forget that when they're training, they have to give a pause, and avoiding holding that Kegel contraction, that tightening of avoiding holding urine, allows the body's natural reflex to do its job. Relaxed muscles are just better able to activate, and then you can get the power that you need to avoid an incontinence event. But even releasing shoulder and jaw and core, gluteal tension frequently throughout the day. When you don't need it, you don't need to hold it. And if your body is in the habit of holding a tight fist, it's going to be harder for it to make the fist to contract to hold the urine. So otherwise, muscle strength does contribute to pelvic floor muscle function. There's been research that shows that the pelvic floor can be strengthened with running and walking, but also with hip rotator muscles especially. But getting a strong, base of support throughout the hip environment is helpful for coordinating pelvic floor, so the pelvic floor doesn't have to hold on for dear life trying to sustain upright posture. So teach people to manage impact forces if they're doing running. I know that you sometimes will run as part of your workouts. Having soft landings helps decrease some of that intra-abdominal pressure. Avoiding overstriding, because that puts the brakes on with every step. Oh, don't look at that. It's kicking me out. Sorry, can you? There.
Your presentations.
Pardon? Okay, are you seeing this?
Yeah, you're good, Mary. That's all we see.
Okay. Wow, it startled me. Okay. Avoid overstriding. I already said that. Sometimes even a slight forward lean can help gain that diaphragmatic breathing when you're upright. And it will also reduce heel strike, which decreases those impact forces. And then, like I said before, hip abductor and external rotators. So those would be the ones that, I don't know if you can see me, but those would be the ones that would take my leg out to the side. That's abduction. And then the rotation is bringing my legs in and out. When they're ready, and many of your clients are strong enough to manage single leg movements and multiplanar movements, which would just be like side to side and going in different directions, maybe reaching in one direction while holding their stability in another. And then introducing plyometric drills comes after they're able to control, for me at least, after they're able to control all of the core, balance, pelvic floor. So here are just some ideas for exercises. I don't know if you can see my whole screen. It's hiding the pictures for me, but so starting with a double bridge, going to a marching bridge, going to a single leg. These are kind of the way that I progress people. I sometimes even start with just, can you hold your pelvic floor as you press your heels into the mat? So I bring it even farther back. But these are all hip strengthening exercises that I'm sure you know well, but some ideas if they need to gain stability before they progress. Also reducing the support with crossing the arms over the chest or going on an unstable surface. They can put their feet on a TRX or on a half ball or on a ball. You can add pulses to increase difficulty and to add to the resistance that they're getting. Anybody who's a runner should be doing single leg squats, because every time they run, they're in a single leg squat, and they should be able to control that valgus moment so that the knee is not caving in. Valgus is just what it's called when the foot is out and the knee is in, and then it goes up. So you want to keep the standing knee pointing forward, keep the hips level, and press through the heel so you get your glutes engaged, keep your balance. If I'm giving too much information, I'm sorry. I just don't know what level everybody is at. So I'm sure you guys know this, but these are some ideas of how you can progress that. So now if you hear these things, I want you to refer to Heather or me or to their physician so that they can get checked out as well. But what Heather and I do is thoroughly screen and say, this is something you need to see your doctor for. This is something that we're capable of treating, or maybe you're fine. Here, try these things. So that's what our screenings are for. And Active PT offers those. It's a 15-minute appointment. We do that for free, just as a community service to avoid people having to wait to get in to see their doctor and stuff. So if you hear that they are leaking with their, especially double unders, I don't know what it is, but the double unders seem to be a problem. Sometimes it's with the clean and jerk. Sometimes it's with a jump and a land. They could be leaking urine or feces. Sometimes just with exertion, maybe they're doing a punch or something, and that's when they leak. Uneven surfaces can contribute to that as well. If they're having pain, I really encourage you to have them see us, because sometimes it's just a tweak that they need to do to their plan. And we can do that in a screening appointment. Say, try this and see if that helps. The sooner the better, because then maybe they can avoid having the long time of coming in for treatment. But for Heather and I especially, it would be tailbone, pelvic or abdominal pain, and any pain in the area between the two sit bones, the tailbone and the pubic bone. And then also urgency and frequency if they feel really comfortable with you, or if you see somebody who goes 3 times during your 45-minute class, that would be a perfect one to say, hey, maybe you want to go check out pelvic floor PT. So now I'll open it up for questions. I really wanted it to just be a brief session. There is my email. It's mkleiss@activeptandsports.com, and Heather is H. Dunphy at the same. But yeah, you guys can, let me just stop this sharing so I can see you a little bit better. What's your question?
Mary, I just had a question about where you're going to be at. Are you moving your office at all to the burn gym here on the south side of town?
Yep, we're actually, that's where I am right now. I'm talking to you from the Salem Road location. So Heather and I are right across the street, I think, from you guys. When I saw your address, I'm like, oh, it's right there. So
would you be okay, just like future, as we go down the line too, like us either, whatever your comfortability is, like us either coming in there and doing like a video with you, or you coming here and doing a video?
Yeah, you know what? I was thinking about talking with you today because tomorrow I opened my schedule last minute. I usually work in Lake City on Wednesdays, but I have someone else covering that. And so tomorrow I have quite a bit of free time and I could come over tomorrow if you had some time, or we can do it here, either way.
I was about to say, like, I would personally just plan on that. Honestly, like whatever works for you, just let us know.
Okay.
That happening. Yeah.
Yeah,
I mean,
I'll contact you after this and we'll work out some details. Does that sound good?
yeah.
Okay. Any other questions? I also have some, I think if you check out our Facebook page or our Instagram, Heather and I have put some beginning pelvic floor exercises on that as well. And you can share that with your members if you want to.
I guess I could ask a quick question.
Yeah.
So bracing, when you take that big deep inhale to like tighten up your core, for those heavy lifts, how many, like what type of like rep range would you recommend when you do that bracing? Like your heavy 5 to 6, or is it like 2 to 3, maybe less?
So I think for, at least for my patients, it would really depend on what failure was for their pelvic floor.
Okay.
And so if failure is 1,
Right.
that's too much, then we've got to build up the pelvic floor coordination and strength first.
Okay.
We have options for that for people who want to do that bracing. I always encourage, for my patients, I'm asking them to continue working out, continue doing their activities, but to maybe bring it back to something that the pelvic floor is not going to fail. And then we'll start working them into, like, I've taken apart the clean and jerk. Like, where is it that you're losing it? Is it as you're going down? Is it as you're coming up? Is it as you jump? Is it as you do the split? You know what I mean?
Right.
So my answer is it depends, I guess. So it depends on where the failure is, and then work up to strengthening to get them ready for that, the higher reps. There are some tools that we can use. There's vaginal weights that we can use for people who really want to train to lifting those heavier weights and be able to hold against that intra-abdominal pressure that comes with the Valsalva. So they're appropriate for some people.
Yeah, thank you.
Yeah. Any other questions?
I don't think I have any. I'm not sure if they have any.
I think a lot of the times with some of our members, it's just like the understanding or having the feeling of what maybe like a diaphragm breath is.
Yeah.
Do you have like a cue that you like, or a cue that you've noticed for people to, how we could maybe just kind of reiterate or reword what that intra-abdominal pressure should feel like?
Right. So I take it back when I'm in here. I'm going to move up my table. I take it back, and I usually have someone sit with their back supported as they're starting, because when you're supporting yourself with your core, it's harder for the diaphragm to expand. So can you see me here?
Yep.
Okay. So I don't know if you can really see me. Yeah?
Yep.
Maybe? Okay. So I would have someone take an inhale and their belly will rise and the abdomen around to the back will expand. So it'll look like this. Let me see if I can get that out of the way. So you see how my chest doesn't move at all, or very little. My belly is kind of rising and expanding. And then I'll have them start to train that in different positions. So when they get better, they'll be able to have their belly here and sit up. I'll sometimes have them sitting forward so that their back is doing most of the support work. And then, I don't know if you can see my hands move at all, but, and then take it to standing and maybe, again, leaning forward a little bit so that they can allow the belly to kind of drop and then take it to standing. So it's really, the cues I give are usually have your belly expand and the chest hardly move at all. So it'd be, make sense?
Yeah.
So then the next cue that I give is as you take your inhale breath, allow all the muscles that you use to hold gas or urine to open, release. For men, I usually say drop the testicles. So you'll inhale, everything will drop and relax, and then you'll exhale. And when I'm teaching relaxation, I'll ask them just to keep quiet during the exhale. So don't even think about anything other than inhale, relax, exhale, keep it relaxed. And then as pain has been taken care of and they're ready to start coordination, then we'll start adding in that, okay, now as you exhale, you'll squeeze and try to hold urine or gas. And there's also a lift with the pelvic floor muscles. There's the floor, which is your hammock muscles. There's the sphincters. So those will close. So there's like a squeeze and then kind of a lift into the pelvis of those muscles. So then I'll start with lying down usually, and then we'll start to train those against gravity. And then we'll progress to different positions like standing, maybe hold it while you sit to stand, because as you move the pelvis, some of the muscles will be lengthening and some will be contracting, and we need to make sure that they're able to maintain the closed and lifted posture despite the fact that the pelvis is pulling on it a little bit. I hope that answers your question, but that's how I work people through.
Yeah, that was awesome. Absolutely.
Okay, yeah.
You said that you do 15 minutes appointments for free for people.
Yes.
How do they get a hold of you? Do they just call active PTs or a website? Is it?
Yeah. Sometimes I'll turn that, the pelvic floor screening, I sometimes will turn into a free half hour, and that's fine. So it'll be 15 minutes to a half an hour. They would just contact our clinic, or they can they can go to our website and schedule a free screening appointment there, or they can send me an email just asking for it if you want to share that.
Perfect.
Yep. And that can work for anything. So if they've got shoulder, if they have, just let us know what it is that you want to be screened for, and we can help out first with a screening appointment if they want to.
And Mary, you have business cards too, obviously, right?
Yes, I do. I'll bring some over tomorrow.
I was about to say that'd be perfect because I think we have some from Courtney and then we have some from Heather, but just obviously get some for you too.
Yeah. Yep. I'll bring some over. Is there anything else that I can bring over for you? We've got, that's probably the best thing. We've got some cards that talk about like leaking or shoe assessment or whatever, but.
No, and we've been working with Courtney, and Courtney was actually going to get us
Screening cards.
like little screening cards where we could take notes and then kind of send them with them for the screening.
Okay, I'll make sure to get those.
I think we'll be able to kind of use those, and then Drayton will be able to like kind of write down the incidences that we've seen, and it's going to be kind of a quick way to communicate with you.
Yeah, that is awesome. I don't know if they have finished making those or not, but I will make sure to get you some.
Awesome. Thank you.
Yeah.
And then pain too. So obviously referral with pain.
Pardon me?
Uh, I bringing up the pain part. I'm sorry.
Yeah.
Yeah. And for the referrals wise, a lot of the times it can happen like during camps, and we like to keep just kind of the ladies moving until the camp is over with. Is there like maybe any exercises you would prescribe that would be safe or maybe effective for us to use just to kind of get them through the camps? That way they can still feel like they got their workout in and they don't have to kind of cut it short.
Right, right. When you're talking about pain, there can be a lot of different causes. I usually recommend, like, if you can get them into a pose that provides them with the most support for their pelvis, then it's only one muscle that's required for them to move, right? Or less muscles at a time. So maybe they're not standing on one leg because that's going to put some shear forces through the hip or through the sacrum. So sometimes just making sure they're not even like side steps can cause problems. So maybe it's easier to do a full squat than a single leg squat, or it's possible to do a bridge instead of a squat. So the more support that you give them, the better they'll be able to manage continuing to work out. If it is a core activation issue, a lot of my clients have maybe a diastasis rectus abdominis. That's the separation of the core muscles in the front. I'll have them start with a fully supported back pose and then just a small leg lift. And then as you make the leg longer, it becomes heavier and harder to lift. So depending on what their level is, you can do some slight leg lifts. There are, let me think. Are there any that you see people coming out of because of pain more frequently than others? And I'd be happy to, if you have some specifics that you come up with even after this course or this talk, go ahead and send me an email and say, okay, it happens to be with this. Do you have any ideas for modifying? And I'd be happy to share that with you, or I can talk with Heather and we can make some videos too.
That'd be awesome. Thank you.
Yeah, we want to be a resource because we really want to keep people moving. That's our whole goal, is to keep people to reach their goals. So let us help them.
I just have a quick question. So like if we're doing an ab day or something like that, sometimes people can say that their hip flexors are bothering them. Like if we're doing a bunch of like toe taps or something like that, is that caused by like a weakened core, or maybe they're just like placing the stress on a different part of their body rather than their core?
Yeah, that's a good question. So a lot of times I'll find when people are doing core activation on their back, they're using their hip flexors to do it instead of the core. Sometimes people will get hip flexor pain when they're standing and doing squats because they're using their hip flexors to eccentrically load, do you know what I mean? And not use the glutes. So there's a lot of reasons that the hip flexors can get tight or overused. If that's the case, if you find that they're doing the activation is more in their hip flexors, I often will have them do something where they're stabilizing with the pelvis instead of doing a crunching movement or a trunk flexion movement. So getting core activation with a cable to the side, like in a Pallof press, or if their shoulders and their body can handle it, maybe doing a side plank or something like that, just that would provide stability without that flexion moment. And sometimes maybe doing a side plank, if it's important for your workout to get the lift of the leg, then maybe you do the side plank and have them do some leg movements from there, possibly. Or, there's a lot of ways to get at it. Kind of depends on what your goal is for your workout.
Sure. What about just doing like an isometric hold where you have them almost in that hollow hold position, like your hips and knees are 90, just to make sure that they're practicing keeping their lower back on the floor? I don't know if you can see that at all or not. Like if they're doing like a V up, or if they're doing toe touches or flutters, like you can tell their lower back's coming off the floor, and then they're messing with their back and they're messing with their hip flexors. They're not
Right.
actually using
Yeah,
it.
that position is my least favorite because I see a lot of people with pelvic pain coming from the SI joint, and putting sacral sitting on that with a C sit or a V sit it can be problematic for people. So I like giving them the support. Their back on the mat, I think, is a good feedback tool for them as well. So isometric hold would be much better than doing a C sit before they're ready, or a V sit, or I'm not sure what you call them. But did that answer your question? Uh-oh, you guys are frozen.
Your connection.
Oh, there you are.
There we go.
Yeah.
There. Okay. Did that answer your question?
We didn't hear anything you said. Sorry.
Oh, that is hilarious. You heard nothing?
You cut out right after C set or V set.
Yeah.
Okay. Well, I probably said it a couple of times. Okay. So the main point I was making is that that's my least favorite core strengthening position, because that puts a lot of pressure on the sacrum, which then puts shear forces through the sacrum. And I get a lot of people coming in with SI pain because they've been sacral sitting in that position of, you guys can see me, but if I'm sitting in a position like this, I'm putting a lot of forces through my sacrum, even no matter what my core is doing. So having the back supported is a lot better way for them to get their feedback. And then doing, like you said, this, or you can make it a little bit harder by making the leg longer. But sometimes people can't even handle that. So then I'll just start here, or start here, one leg lift, and it's controlling with breath and things like that.
Okay.
Does that answer your question?
Yeah.
Oh, okay, good. Sorry, you cut out.
When doing that, so I know that one thing that Leighton just brought up. So one big problem for a lot of people, even when they do some exercises like that, at least when I notice, is they lift their lower back. And
Yeah.
so I think do you want them to have their shoulders tucked up? They don't necessarily have to be on their sacrum, but at least if they bring their shoulders up, it forces them to at least get onto that lumbar spine rather than allowing that lower back to like have that extra arch.
Yes. And so I think that in the training that you guys are doing, that's one compensation mechanism that you can do if their core is not strong enough to hold it in a neutral spine. So
Okay.
yeah, I think that's fine and that's safe. I always try to get people to the point where they can like find their neutral and hold their pelvis in that position, not even pressing it to the floor, because I want them to be able to seriously have the core stability to do what I'm asking them to do.
Right. Okay, makes sense.
Good questions.
I don't have any more for right now. I can't think of anything.
Okay. Well, thank you guys. I will stop the recording, so that will help the rest of the group hopefully with this. Oh goodness, what's this doing? I hope it's okay there. End. Oh, that's canceling the meeting.